Here we talk about the mesodermal derivatives now, and talking about the dorsal view of the embryo. If you remember, we have discussed that there will be a layer of ectoderm. If you remove that, deeper to that, more ventral is mesoderm. And here we are talking about the axial mesoderm, which is called as notochord. If you say this is the notochord, which is the axial mesoderm, if you remember, we have discussed that the notochord is going to lie between two structures, which are the primitive pit in the primitive streak and the anterior or cranial edge procaudal plate. This axial mesoderm or notochord is important because it is going to stimulate the overlying ectoderm to form the nervous system. Now this is axial mesoderm. What is on the side of that? Side means para, so para-axial mesoderm. Let us look at the para-axial mesoderm then. As you find that we are talking about the para-axial mesoderm, here it is shown. So this is the para-axial or on the side of the axis mesoderm. What is still more lateral? That is called intermediate mesoderm. Now when you say it is the intermediate mesoderm, let us mark it, and it is here, this area. Now if you are telling that this is the area of the intermediate mesoderm, then what is the most lateral mesoderm? The most lateral is the lateral plate mesoderm. So let us focus upon lateral plate mesoderm also. You will notice that now we are looking at the lateral plate mesoderm, which is the most lateral, and you can also mark it here. This area is the lateral plate mesoderm. Now let us look at one more diagram to discuss the same story again. This is the transverse section showing the embryo, and as we have already mentioned that there will be a notochord in the center, which is called as axial mesoderm. Now if you say this is the notochord or axial mesoderm, on the side of that will be paraxial mesoderm, intermediate mesoderm, and lateral plate mesoderm. So that is the point which we are going to magnify and discuss more in detail. There is a dorsal amniotic cavity and ventral is yolk sac cavity, which will also see, but then the third cavity will come, and which is called as the coelomic cavity. Let us talk about the third cavity as well. So in this diagram, you can once again notice dorsal cavity, amniotic cavity, ventral is the yolk sac cavity, and there will be a third cavity developing, which is called coelomic cavity. This is the coelomic cavity. Now when you're talking about the coelomic cavity, it is one, but since it is a section, you can see it around on the right and left side, but this is the third cavity which we were talking about. Let us focus upon mesoderm once again. You see, this is the axial mesoderm, the notochord. Now if you say this is the axial mesoderm or notochord, there is a paraxial mesoderm which is going to form what is called as somites. So when you are talking about the para-axial mesoderm here and here, on the side of axis para-axial mesoderm is going to form somite, and somites will give us some derivatives which we have to discuss further. Then you know, still more lateral will be the intermediate mesoderm. So this is the region of the intermediate mesoderm. Remember, it is the intermediate mesoderm which is going to form the kidney, testis, and the ovaries. So kidney, testis, ovaries or genitourinary system develop here from the intermediate mesoderm. Now as you go more lateral, you will see this is the lateral plate mesoderm. And when you say lateral plate mesoderm, as you are marking it, this is going to have two parts. There will be a dorsal and there is a ventral. Dorsal is the somatic and ventral is the splanchnic. Splanchnic means visceral, separated by the coelomic cavity, the third cavity. Now, what are they doing? We have to find out by making a diagram ourselves. Actually, this cavity is going to form three more cavities. Which one? The coelomic cavity is going to give us the pericardial cavity, number one. Number two, pleural cavity. And number three, the peritoneal cavity. Now, these cavities, they need membranes like peritoneal membrane and the pericardial membrane and the pleural membrane. And the membrane themselves will have two layers. If it is covering the viscera, visceral pleura, and if it is covering the body wall, parietal pleura. So similarly, you have parietal pericardium, parietal peritoneum, but then you have visceral peritoneum and visceral pericardium also. Where are these membranes coming from? Understand, dorsal somatic lateral plate mesoderm form parietal peritoneum, pericardium, pleura, and the ventral visceral lateral plate mesoderm will form visceral layers of the pleura, peritoneum, pericardium. Let's make a diagram now for the same. So let us make a diagram which is actually the transverse section of the embryo, showing the three germ layers after gastrulation, and what we are focusing upon is the mesoderm. Now, when you're talking about the mesoderm, there was one axial mesoderm, and that axial mesoderm is called as the notochord, and that notochord is going to disappear but leave behind one vestigial remnant, and that vestigial remnant is called as the nucleus pulposus of the intervertebral disc. In the intervertebral disc between the vertebra, you have got a nucleus pulposus, which is a vestigial remnant of the notochord. On the side of the notochord, which is axial mesoderm, you have got what is called as para-axial mesoderm. Now, this para-axial mesoderm, which you are talking about, this para-axial mesoderm is going to form the somites. And what the somites will form, that we have to discuss in a short while. What is still more lateral to that? Still more lateral to that is the intermediate mesoderm. Now, if you say this is the intermediate mesoderm, fine. But what is still more lateral? That was the lateral plate mesoderm. So here you can mention that this is going to be the lateral plate mesoderm, can be seen on one side of the body and the other as well. So on the right side, left side, yes. Now this lateral plate mesoderm is divided into two by a cavity, the third cavity, which is called coelomic cavity. In fact, we already have told there is one cavity which is dorsal, the amniotic cavity, ventral, which is the yolk sac cavity, and now the third cavity will come, which is coelomic cavity. This coelomic cavity, which is coming here, is going to divide the lateral plate mesoderm into two parts. There will be a dorsal. You will notice that there is a dorsal somatic lateral plate mesoderm, and then you can also mention there is a ventral visceral. Now, when you say it is the ventral and the visceral, you can also mention that it is going to be the splanchnic lateral plate mesoderm. So there is one splanchnic lateral plate mesoderm and there is a somatic lateral plate mesoderm. Now, what are they doing? We have learned earlier that this coelomic cavity is going to form three cavities, namely the pericardial cavity, pleural cavity, and peritoneal cavity. And those cavities need membrane like peritoneum and the pleura pericardium. So we have earlier mentioned it is the dorsal somatic which will form parietal component. If it is forming the parietal pleura, or parietal peritoneum or parietal pericardium that is going to line the body wall. What about the viscera? The viscera are inside the body wall and they are lined by visceral peritoneum, pleura and pericardium. So who will form the visceral layer? Of course, the visceral layer will be formed by the visceral lateral plate mesoderm. So the lateral plate mesoderm, which is visceral and ventral, is going to form the visceral peritoneum, pericardium and pleura. Now, it has some more functions, like you will notice that ventral visceral lateral plate mesoderm is going to form cardiac and smooth muscles. Now, if it is going to form the cardiac and the smooth muscle, is it forming all the smooth muscles in the body? No. There are some smooth muscles which do not develop here. Can we name those muscles which are exceptions and do not develop here? Let's put their names because exceptions become questions. So as you're talking about them, I'll mention their names here. 1, 2, and 3. If you remember, myoepitheliocytes of the skin are smooth muscles. So they came from surface ectoderm. So myoepitheliocytes of the skin are coming from the surface ectoderm. They do not come from the lateral plate mesoderm. Then what is the exception number 2? If you remember, we have discussed earlier iris muscles. Now, if you say iris muscles, they are sphincter pupillae and the dilator pupillae. So where is this sphincter and dilator pupillae coming from? Neural plate ectoderm. So sphincter pupillae, dilator pupillae muscles of iris come from neural plate ectoderm. Third exception, which I'll give you now, is the detrusor muscle. And what about the detrusor muscle? Detrusor muscle is a muscle of the smooth muscle of the urinary bladder, genitourinary system. So it is not developing from ventral visceral lateral plate mesoderm. Then where is it coming from? From the intermediate mesoderm. Now remember, this intermediate mesoderm is going to give you the detrusor muscle. Not only that, actually intermediate mesoderm is giving us major portion of genitourinary system. Like what it is giving? I'm telling you, intermediate mesoderm is the one which will give us the major portion of the genitourinary system. And you can tell kidney, testis and the ovaries develop here. Now, kidney, testis, ovaries develop from the intermediate mesoderm. Intermediate mesoderm also forms smooth muscles here, like the smooth muscles of the urinary bladder or the smooth muscles of the genitourinary system come from the intermediate mesoderm. What is this paraxial mesoderm doing? Forming the somites. And what is the somites doing? Somites will have 3 parts. Let's show the 3 parts now. So when you are talking about the somites, will have 3 parts. Let me show the 3 parts now. As you are dividing the somites into 3 parts, you will find that the most medial is called as sclerotome. And what is the sclerotome doing then? The most medial is sclerotome on either side, and the sclerotome is going to form the vertebra. You have to understand that the vertebra develop in halves. Half of the vertebra will develop on the right side, half of the vertebra will develop on the left side, and then they fuse to become one vertebra. So half of vertebra from each side and fusing to become one vertebra, yes. And that vertebra came from paraxial mesoderm, which itself is somite and sclerotome. Then what is this middle portion of somite? The middle portion of somite is called as myotome, and that myotome is going to form muscles, usually the skeletal muscles. Now when you say that the middle portion of somite is going to be myotome forming muscles, mostly skeletal muscles. It can form which skeletal muscle? Actually, it's a statement of Gray's Anatomy. All the skeletal muscle in our body come from para-axial mesoderm. So this is the para-axial mesoderm, which is going to form the all skeletal muscle of our body. Yes, like which one? Could be anything, like the masseter muscle, skeletal muscle of the perennial arches, or could be biceps brachii, or could be the diaphragm muscle, or could be the biceps femoris, lower limb. So you're telling any skeletal muscle in our body? Yes. Will come from para-axial mesoderm. Yes. The myotome. Yes. Then what is the lateral most thing? Lateral most thing, if you say, then we'll mark it as the dermatome. Now, if you say this is the lateral most and it is called as the dermatome, what is the dermatome doing? Laterally. This is the lateral most thing, which is the dermatome part of somite, is going to form skin dermis. Now, if it is going to form the skin dermis, dermis is mesodermal and comes from para-axial mesoderm, somite, most of the time. Now, this was about some details of mesodermal derivative, but be careful. Still, there are some things left, like which one? You talked about the vertebra, yes, from the scrotum. What about the skull bones? Skull bones, if you say anterolateral, then it is coming from the neural crystal. Then what about the posterior? You mean to say occipital bone? Yes. Occipital bone comes from the same place from where the vertebra is coming from. You mean to say occipital bone is also from para-axial mesoderm? Yes. And what about the upper limb and lower limb bone? That is called appendicular skeleton. Let us talk about the appendicular skeleton also. For example, humerus bone or femur bone or upper limb, lower limb bone. So where they come from? They come from dorsal, somatic, lateral plate, mesoderm. Are you trying to say dorsal somatic lateral plate mesoderm, which was forming parietal layers of pericardium, pleura, peritoneum, is also forming the humerus bone? Yes, humerus bone develop here and the femur bone develop here, upper limb, lower limb bones develop there. And let us look at the next diagram. So as you look at the skeleton, there is two parts of skeleton. One is called as the axial skeleton, and in the axial skeleton you will include the skull and the vertebra. Skull vertebra is axial skeleton. Then there is appendicular skeleton, upper limb and the lower limb. When you say axial skeleton, the skull, we have mentioned that most of the skull bones are from neural crystal, but posteriorly there is some contribution by para-axial mesoderm. So what was that para-axial mesoderm forming? The posterior bone, occipital bone, and also the vertebra. So vertebra developed from the same source? Yes, actually. Vertebra developed from the para-axial mesoderm, the somite, the scleroderm part of somite. What about the upper limb, lower limb bones, then appendicular skeleton? If you say upper limb bone, or if you are telling the lower limb bone. So upper limb or lower limb bone is the appendicular skeleton that is coming from lateral plate mesoderm. If you say upper limb, lower limb bones are appendicular skeleton coming from lateral plate mesoderm, which part of lateral plate mesoderm? Dorsal somatic or ventral visceral? And it is the dorsal and somatic portion of lateral plate mesoderm. Now we find this question asking, all the following except come from para-axial mesoderm. We already know para-axial mesoderm is going to form skeletal muscles. And you can see there are already some skeletal muscles here. Like this is the masseter. Masseter is a pharyngeal arch muscle. It's a skeletal muscle coming from para-axial mesoderm. And then diaphragm is a skeletal muscle coming from the cervical somite. If you say diaphragm come from cervical somite, in the beginning, diaphragm develop in the cervical region, later descend down to the thorax abdomen region. bringing a nerve also along with that, and the name of that nerve is phrenic nerve. What is the root value of phrenic nerve? Must be cervical. Which cervical? Cervical 3, 4, and 5. So, diaphragm is a skeletal muscle coming from cervical somite. Number 3, 4, 5. What about the biceps femoris? Maybe it is biceps femoris, lower limb, or biceps brachii, upper limb. They are skeletal muscles. So, all skeletal muscles should have come from the paraxial mesoderm. Are you trying to say that the answer is choice number D? Yes. Why? Because the smooth muscle of urinary bladder. So smooth muscle of urinary bladder must have come from intermediate mesoderm. So your answer remains choice number D. You can also look at this question on mesoderm asking muscle derived from ventral, visceral, lateral plate mesoderm. So what do you think is your answer? If you remember, we have already discussed some smooth muscles which are exceptions and they do not develop here. Like which one? The myoepitheliocytes. Why? Because they are actually coming from surface ectoderm. Then what about the iris muscle? Iris muscles are sphincter and related pupillae and they come from neural plate ectoderm. Then what about the smooth muscles of the gut tube? Yes, that is the answer. Now if you said this is the answer, smooth muscle of gut tube will come from here. What about the detrusor? Detrusor we already told. Detrusor will come from the intermediate mesoderm. So this question was asking which of the following come from ventral, visceral, lateral plate mesoderm. And you have only one answer, and that is the smooth muscle of gut tube. They come from a source. Otherwise, the exceptions are A, B, and D, which we already have discussed.